45-year-old man presents with a long history of ulcers on the bottom of his. He recalls having a similar looking ulcer on the side of his penis when he was 19 years old, for which he never sought treatment. The patient denies any fever, chills, or constitutional symptoms. He reports multiple sexual partners and very promiscuous sexual history. He has also traveled extensively as a writer since he was 9. The patient is afebrile and his vital signs are all very normal. RPR test is positive and the result of Treponema pallidum particle agglutination, which is TPPA, is pending. Which of the following finding would most likely be present in this patient? Hyperreflexia, wide base gait with a low step, positive rhomboid sign, memory loss, and agraphesthesia. So based on what they are describing over here is the syphilis picture, right? He has RPR positive and then TPPA is kind of pending. He had an ulcer when he was 19 years old and maybe it wasn't bothering him, what we call painless chancres, right? They're painless, so they don't bother. He might just seen it and he forgot. He thought it's not painful and so he never sought any treatment. But remember that syphilis can cause further symptoms and further disease in itself. We have primary syphilis, secondary, and we have tertiary syphilis. This patient probably had primary syphilis, painless chancres, and it is diagnosed with. Can somebody tell me how can you diagnose primary? They have not mentioned over here, but you can diagnose it with dark field microscopy. Yes, you can see the chancres on genitals, but chancres on genital on physical examination may look like similar to other ulcers. Okay, and that's why we need to confirm the diagnosis. So you can do dark field microscopy. Can somebody tell me what causes syphilis? Treponema pallidum. Exactly right. So it is caused by Treponema pallidum, and so when you don't treat it, it may lead to secondary syphilis, which is probably what this patient has as well because he has ulcers on the bottom of his feet. In secondary syphilis, you have disseminated disease. You have maculopapular rash involving your palms and soles. You have what we call condylomata lata, which is wart-like lesions on genitals, and they may also have lymphadenopathy. Some of the screening that you can do with secondary syphilis is going to be RPR VRL, like they did in this patient, and RPR was positive. And then it is followed to confirmatory test, what we call PPPA, FTA-ABS, or immunoassay, enzyme, right? If you still don't treat it, then it's going to lead to tertiary syphilis. Tertiary syphilis, it involves your viscera. It causes gammas, it causes vasovasorum destruction leading to aortitis. It causes neurosyphilis as well. Neurosyphilis also depends what is involved. So if it involves your spinal cord, then that leads to Tabes dorsalis. If it involves your brain, then that leads to general paresis. If it includes your eyes, then it causes what we call Argyll-Robertson pupil, Robertsonian pupil, right? So that's going to constrict with accommodation, but it does not react to light. Another signs and symptoms include wide base gait. Again, these all are neurosyphilis kind of symptoms. Then rhomboid sign, which is seen over here, right? Positive rhomboid sign and the Charcot joints as well. Again, you can, especially for neurosyphilis, you can check your CSF with same as RPR, VDRL, and also you can do TPPA, FTA, ABS, or enzyme immunoassay as well. The Tabes dorsalis specifically involves your posterior column of your spinal cord, and posterior column runs your pathway, what we call the DCM, right? The dorsal column medial meniscus pathway that carries sensation from your body. And that's why if that is involved, patients are going to have loss of vibration, they're going to have proprioception loss and even touch as well. The loss of conscious proprioception is what leads to the rhomboid test over here. That means they cannot stand with their eyes closed. They're going to sway. Okay. This rhomboid test you'll also see in cerebellar injuries or lesions, usually cerebellar burn. Some other symptoms of the neurosyphilis also include some lancinating pains, like nerves just kind of they get activated over here and there, so it's going to cause the lancinating pain over the limbs and the vessels. You can also have autonomic dysfunction leading to sexual dysfunction, bladder incontinence. So basically, your neuro, your viscerals, everything gets involved when it comes to tertiary syphilis. And that's what this patient probably is progressing in. So what would be the treatment? Can somebody tell me the treatment for syphilis? Doesn't matter if it's primary, secondary, or tertiary. Penicillin, right? You give them IV penicillin G. If you are allergic to penicillin, you can give them ceftriaxone. If they have allergies to penicillin, like as in severe allergy, you can also do desensitization. And if they cannot take any of the medication like ceftriaxone, penicillin, desensitization also is like progressive penicillin therapy only. So if they cannot take any of those, then you can do toxin. Okay, even in pregnancy, we do toxin. Sorry, we do desensitization if there is a pregnant woman. So other options, hyperreflexia, there is no motor involvement as I mentioned in deep dorsalis, so you will not see any hyperreflexia, no motor involved in neurosyphilis, unless your brain is affected and that would lead to general paresis, not hyperreflexia. It causes wide base gait with a low step. It does cause wide base gait, but with a high step, not low step. The high step, low step means they have a fear of falling. They can trip over, right? And high step means they're just going to slam their leg on the floor. Memory loss, it doesn't affect your cognition and your memory. So, no, nothing wrong with your memory and anything like that. Agraphesthesia means when you write something on your skin, you're supposed to recognize it. When you cannot do that, that's what agraphesthesia means. And usually it is affected when you have sensation issues, such as your thalamus being involved or your parietal lobe being involved, because parietal is your postcentral gyrus, right? That takes your sensation. So if you have lesions in those areas, that's what will lead to agraphesthesia. Syphilis doesn't affect them, and so you will not have agraphesthesia in syphilis.
Thanks for watching. Please give a thumbs up and subscribe for more.